Typically, I tend to ignore pain, especially pain that comes and goes or that is, relatively mild or infrequent, and just thinking that it'll heal itself or that I'll get better. And this was true of the knee pain. I just ignored it and kept ignoring it for months on end. And as I did that, it kept getting worse and worse and worse. Actually, I went to have it looked at one time and went to the doctor, and she gave me some pain pills and a cortisone shot in my knee, and that worked for a short period of time. So I thought I was healed, and then the pain reoccurred after that, and then it got so intense that I couldn't ignore it anymore. The knee pain, very mild, would be just a noticeable ache. So that would be a mild case, and then eventually, as it grew, I would be limping, and then even limping upstairs, putting the good leg first and then following with a bad knee. And it just increased after that. I would take myself out of, I'm a health and physical educator, so I would take myself out of activities because I couldn't participate. I'd find that especially in basketball. I'd like to get in there for a few minutes and sort of keep the game going. But then there was eventually a time where I had to completely not even get involved in basketball. The pain grew, really, really bad. It's where, I'm noticeably limping, and people are asking me all the time in the hallways, what's the matter with your leg? What's the matter with your knee? Did you get hurt? And I said, it's just, just my knee. I said I got a bad knee. Ultimately, the pain got so bad that I had to go. I said I can't ignore this any longer, and I have to, see somebody about this. So I went to my primary care physician. My primary care physician recommended Milford Orthopedics. I selected actually Dr. Madgett, and it was a great selection for me. My first visit with Dr. Madgett was relieving for me because I had this pain for 2 years, and there was a cause that was finally identified in that he found the meniscus tear through the MRI, and he also recommended a plan of action pretty much that same day. Dr. Madgett explained to me that because in that area of the meniscus tear there was no blood flow, that he couldn't repair it. He couldn't suture it back together and have it heal because there was no blood flow there. So what he explained to me that he had to do is to go in there and just essentially finish the tear and then take the little piece out. And in doing so, and doing that, then I would be pain-free and back on my feet in a relatively short period of time. After that initial visit, I was quite relieved because, like putting a name with the face, we were able to put a cause with all the pain that I had been experiencing. And, after having met Dr. Madgett for the first time, and he really instilled a sense of confidence in me that I hadn't had before, and that he was going to take care of the problem, and I was going to be fine, and that the pain would be alleviated, and I would be back on my feet. Dr. Madgett was able to schedule the arthroscopic knee surgery within a day of the initial diagnosis of having seen him for the first time. I was here a long time ago at Milford Regional, and I received in the emergency room, and I received very, very good care in the emergency room. And I did recall that experience when I chose Milford Regional to be the site of the surgery. The pre-admission process at Milford Regional was, was very comprehensive. Not only did it involve, I think some more X-rays, and blood tests and those kinds of things. But also, I was upstairs, and they fitted me for crutches, had me practice on the crutches, gave me a little instruction on crutches. The day of surgery was a fairly average day. My brother-in-law was able to drive me to the hospital, and went to the day surgery there, where they were very, very kind to my brother-in-law and gave him a good picture of how long I would be out, and then when to come back, and that they would call him and give him time to come back and pick me up. And so off he went, and off I went into the day surgery. Put on the Johnny, and then got in bed. And the first thing they asked me, I remember the first thing they asked me is, are you cold? Do you want any blankets? Do you need anything? In addition to a blanket, they gave me a heating pad. So it was, they were certainly looking out for all my needs, and they were trying to make me as comfortable as you can be when you're waiting for surgery. I was amazed at the level of safety that all the people in connected in the day surgery unit there. They would come up and make me feel good and ask me a question, but they would also ask me serious questions like, what's your name? What's your date of birth? What leg are you here for? All the nurses in that unit did that for me. The anesthesiologist did that, and ultimately, finally, Dr. Magic came in. He even did that. He knew where I was. He even did that, and then put his initials on the correct leg that was going to be operated on. The level of safety that the staff at Milford Regional exhibited just made me feel, ultimately confident that the surgery was going to go well, and I was very relaxed. I wasn't nervous at all, and in a very uncomfortable situation, I wasn't nervous at all because time after time, they just kept making sure that I was the right person, that they were going to be preparing the right knee, that they had the right person with the right birth date, and it was a good feeling. I was particularly impressed with the care that I received after surgery as well. I can remember the woman who was administering the pain medication was was with me for a long period of time, and making sure my level of pain was manageable, and asked me how this feel, and adding more, and then asking me how it felt, and then we together, it seemed like together we ultimately got to a place where I was comfortable, and that she was that she had administered the appropriate amount of painkiller medication. So it was like we were working together on managing my knee pain. After surgery, and I was released from the hospital, I went home with some discharge orders instructing me what to do if things weren't going smoothly, and then I also left the hospital with a prescription for some pain medication, so that if the pain got worse, we could deal with the pain there at home. After I got home, amazingly, I believe I slept very well that night. I got a good night's sleep and was rested and ready for the morning, and I think I spent most of that day on crutches, and then towards the end of the day I started getting braver and just putting more and more weight on the knee, and by the end of the day I was by the end of that first day I was on one crutch. I had the surgery on Thursday. By Sunday I was off crutches altogether and back to work on Monday. When I got back to work on Monday, I can remember this specifically going upstairs, because I can remember my office is upstairs, as the boys' locker room is upstairs in Franklin High, and I can remember going up those stairs in much less pain after surgery than prior to surgery, and that was a good feeling. Prior to surgery, I was limping pretty noticeably, and when I got back on that Monday after surgery, people did notice right away that I wasn't limping as much, and I said, well, I had the surgery. And they said, you did? You had the surgery? I said, yep, I had it on Thursday. And they said, where are your crutches? I said, I don't have any. I'm done with crutches. And it was, everyone who at work was amazed that I was back and ready to go. I think the pain subsided probably totally within a week, and then I just had a little bit of swelling left over, and that was probably gone within 10 days. And probably on the 11th day, it was like I didn't have surgery at all. The school year has just started again, and we're just getting back in the full swing, and already I'm playing badminton. Our first unit for physical education is badminton, and I'm playing badminton and instructing badminton with the kids. Probably after badminton, we'll do a basketball unit, and I'm looking forward to getting back out there and just playing a little bit with the kids. I notice all the areas in the school where I experienced pain because our locker room was upstairs, and I have to climb those stairs many times. I can do it, pain-free now, 2 at a time if I need to. There's also a shorter set of stairs up to my classroom, and I can remember many times holding onto the handrail and picking one leg up and then putting the other one down, and now I just bound up those stairs as well. So, my life has changed drastically since my surgery. I'm looking forward to getting back to the stairs in Gillette Stadium. I think there are 77 of them, and I climb them about 10 times, and I did that Actually, during, while I was in pain, when I had periods where I wasn't in that much pain, but now I can do it pain-free, and it's actually a pleasure to go to those stairs rather than, torture and just trying to stay fit. Now it's a pleasure to go to the stairs and climb the stairs at Gillette Stadium. One of the things that, I'm a boater. I love boating, and one of the things that was affected, negatively affected with my meniscus tear, is boating, because I wasn't able to take the bounces on the waves, it actually hurt. But now, and during the summer, because I had my surgery in April, during the summer it was a pleasure to be out there on the water again, because we were bouncing around, and I could just bend my knees and use them as shock absorbers, and without any pain, and it was fun to do again. It was fun to be boating again. My experience at Milford Regional was a very good experience. I think it was a much better than average healthcare experience, because those experiences are always filled with trepidation and concern and worry, and I think the one that I had here at Milford Regional wasn't. I had a little bit of that, obviously, because of the unknown, but as I kept getting further and further into, with the pre-admission testing and the surgery and the care afterwards, I think it was a great experience. I'm glad that I chose Milford Regional as my surgery center. I've already had many people come up to me and say, wow, your surgery really went well, and how you feeling? And I take every opportunity I can to recommend Milford Regional and Dr. Magid if they have orthopedic needs.